My name is Philippe Pereira. I'm French, working in Germany for the last 26 years already. The name is Portuguese, so I'm perfect for Humanitas. I'm a European guy. Research publication in the medicine is, of course, very important. Research medicine is one of the field with the highest level of improvement. So you have to perform research, especially in our field, in the interventional radiology. You have technical improvement every week. So research is fundamental. You need that. You need for the communication with colleagues. You need for the teaching. You need to advance the field of the medicine, and you need to publish that. It's necessary because you have to translate your knowledge to other people. I do believe that performing our own educational path in different countries is definitively an advantage. The best example is in my own family. My daughter speaks 6 languages, and she's performing study part in Germany, part in Luxembourg. So we have the possibility to see different way of life. It's important, different education. You will also be confronted with different diseases, different therapeutic way, treatment way, approach to the patient, etc. Especially in the medicine, it is so important to have approach of different countries. And I mean with that, not only in Europe, but also leaving Europe to look at different way in South America and in Asia, for example. It's very enriching, very important for medicine. Multidisciplinary approach is in some field, in the majority of fields of medicine, the only way to do that. We are confronting with providing the best treatment for patients, providing a cheap treatment. We have also financial pressure. And the most important aspect is you treat patients, so you have to combine the best treatment therapeutic solution from all different disciplines, especially in oncology. Oncology is, per definition, one discipline of the medicine when you have to work together with oncologists, with surgeons, with radiation therapists, interventional radiologists, etc. Alone, you never have this solution. You need this interdisciplinary approach. Especially in the medicine, you don't want to train with patients. So I believe that simulation is quite important. Also, you can improve your team by performing regular simulation. And medicine is becoming more and more technical. Yeah. Also, if you are talking about drugs, the way the drugs are acting in different diseases. Also for that, you have some simulation. Simulation can be also software simulation, for example. So simulation, of course, for field like surgery is quite important, but for interventional radiology also. So you will have to do, as a medical student today in 2016, you should have to do with some simulation in a so large part of different diseases that it is necessary to have that. And it's very good if Humanitas do that. There is I don't know for Italian, but there is a trend in Europe relating to the fact that even more medical students are women and not men. In Germany, for example, it's 2/3 now. 2/3 are women. So there is a trend to specialties in the medicine, of course, pediatric, something like that. So there is automatically a filter, a new filter. That's one aspect. The other aspect is that more and more medical students are very interesting, but by the technical aspects. And when you look at the improvement in the computer technology, for example, I'm very glad to see that there is more and more students moving, for example, to feel like a radiology or interventional radiology on to this also this discipline that could be in the center of an interdisciplinarity. And there is I see these trends in the last, let me say, 10 years, 8 years, 10 years. So that's, I believe, I'm interventional radiologist, so I found it's very good to have these trends. But this technical aspect is improving the acceptance also. And this one of the trends for the medical student, at least in Germany. Just one advice. It's the best job you can have. One important aspect is medical study is so large. Yeah, it's so large that you can become a gynecologist, or you can become a neurosurgeon. You can become a psychiatric. So the field is so large that everybody will find really the best solution for himself. You can move from one to the other. You can work also with other medical discipline. You can combine all together. Just give me a field when it is so large and when you have so many possibilities, like in the medicine. I don't know each other. I don't know. It's really the possibility to start. You have the basis is the same. In the majority of countries in Europe, you make 1-2 years, the first is the same. And after you will feel that this discipline is more interesting for you and it is more exciting to do that and to do that. And you can move from one to the other. And that's a specific for medical study, I mean. It's interesting to have to do with patients.